Hello everyone, let's try to solve this question together. So here we have a 23-week premature fetus who is about to deliver. The NICU team assembles at the delivery room. So the initial peak inspiratory pressure, which is PIP, and post and expiratory pressure, which is PEEP, should be set at. What do you guys think? This question is framed in view of the NRP 9th edition in particular. So what do you guys think is the correct response here? Okay, the correct response here is 25 cm of water for PIP and 5 for PEEP. NRP about PEEP, there is not much disagreement. The LCOR committee and everybody agrees that PEEP should be 5 for all deliveries, but there is variation in PIP. The bigger babies greater than 32 weeks, you can start from 25 and go up to 30, while in less than 32, you can go 20, and then you can go from 20 to 25. But the discrepancy is that, initial guidelines says that use the higher inflation pressure. So 25 is being suggested as initial PEEP irrespective of the gestational age. So there is slight confusion with that. The reason is because they have given a range, and the natural tendency among practitioners and providers are that to start on the lower range and then go up. But the rationale behind, suggesting the higher PIP is, inflation pressure, which we're going to talk about later. So let's go with again. So the answer here is 25 and 5, PIP and PEEP. So this is the reason, like we talked about, that why the NRP 9th edition suggests using high inflation pressure. The idea again is that, it will move the fluid out of the airspace. And the second thing is that it will inflate the alveoli. So these are the two things that are, that's why the initial inflation pressure should be slightly higher than the range which is provided. Anyway, the whole idea is, which I'm going to talk about further, that one has to be cognizant about that changing the ventilation rate and changing the PIP will really change the mean airway pressure, which is ultimately detrimental to these small premature baby's lung, because that can cause barotrauma, and NRP does talk about that risk of barotrauma. So anyway, let's go with a small slide, suggesting or explaining. So this is the slide. The reference is given on the top. So basically, you guys can notice here that just changing the rate will also affect the mean airway pressure, because in calculating the mean airway pressure, you need the rate, inspiratory time, PIP, and PEEP. And there are different formulation, but this is online calculator, so we use that. So for example, in the first two boxes, you see that the rate is 30. So somebody is using breathe 2-3, breathe 2-3, the lower end of the ventilatory rate. So see the difference in the MAP. It's not that much, from 8.7 to 10, which is not that much. And same here from 12 to 15, so not that much if you are somebody's using the higher rates. But the point which you want to make, that if somebody is using the higher rates and using 25 in inflatory pressure, the MAP would be 15, which looks high for these, especially 22, 23 weeker. This looks like a high thing. So one just have to be cognizant about that, and that's the whole purpose of this presentation, that you have to keep into account the cycle, how much breaths you are giving. Of course, PEEP is constant in NRP, so you're not worried about that. But changing the PIP from 20 to 25 would be detrimental in generating the MAP. Just be aware of that. So like we said, see here, and from 12 to 15. So this is a nice article, and it's open access, so please do read about it. They also recommend a range of PIP to start with is 20 to 24. So again, it has to be unit specific in keeping the NRP suggestions in line. So now going back to the question, so what is the PIP we should set on a delivery on a 25 weeker? Again, is unit specific. The whole idea is to avoid the variation. That is the main idea, that we should prevent the variation in the practice. So that is the main key here, that please prevent variation. Do agree upon one pressure on less than 32 weeks as your unit policy, because you don't want problem in the delivery room, between the respiratory therapist, the nurse practitioner, the neonatologist, and nurses. There should not be variation, because as NRP suggests, a range. And like I said, is smaller, very small premature babies are a change in PIP from 20 to 25, and using a higher rate could change the MAP from 8.7 to 15, which is very high. So again, just be mindful of that every parameter on ventilation changes the MAP. So I hope this will create some discussion, and please do comment on that. And again, like I said, we all should follow the NRP initial pressure guidelines of using 25, irrespective of the gestational age, to make it easy. But again, the debate is still on, and like I said, many things have evolved over a period of time in NRP. So I hope in the next edition, or people will discuss it and then talk about more that what should be the best initial PIP in extremely premature babies. So please do like and subscribe to our channel, and you guys have a wonderful day. Bye.